Hey everyone, I wanted to come on here and quickly talk to you a little bit about COVID-19 and try to alleviate some of the fear and put some facts behind what's actually happening. So around early December or the late of last year, this virus jumped literally from species to another species. It went from animals to humans. And we've seen it before. We've seen viruses do this before. However, this one seems to be a little different. And why is this one different? Well, the usual seasonal flu, or even H1N1, has a reproductive ability of about 1 to 1.6. So that means for every infected person who has the flu, they'll probably infect one other person. This one, however, COVID-19, has the ability to affect 2 people. So for every person that gets an infection, two other people will likely get that same virus. So how can we prevent that? And the reason why we're hearing so much in the media right now and so much from healthcare practitioners and governments to socially distance ourselves is because what we're trying to do is lessen the moment that everybody has it together. So what we don't want to see is a big spike at one point in time where all of our resources are utilized and people are still getting it, and therefore we don't have the ability to treat them. So that's what they mean by flattening the curve. The disease or the virus may last longer, but it won't be as severe, and we'll be able to care for all of the sick people that have it. And healthcare practitioners like myself working in the emergency departments or in the ICU, we won't have to worry about deciding who can we treat and who can we not treat, because we have the resources to care for everybody. So one of the things that we can all do as a collective and as a community is socially distance ourselves. And I look at it like the game of Pong. If you think about it, remember in that game, back in the day, you had this one ball that hit the walls and it was pretty easy to maneuver. But as soon as they added 2 balls or 3 balls and everybody was all over the place, or all these balls were hitting each other, it was chaos erupted and all the balls ended up being lost, even though one would think that with more balls you'd last longer. It doesn't happen that way because they all end up hitting each other. The same thing happens if we're not socially distancing ourselves. So if everybody keeps going about their normal daily lives and we're all interacting with each other, we're all likely to touch each other at some point or be in contact with somebody who has the virus, in which case we're going to get this massive spike. But if we distance ourselves now, and it's such a crucial time to do that, actually last week was probably even more crucial, but we can still play a factor. And if we have the ability to distance ourselves now from people that aren't necessarily essential to our daily lives, we have the ability to flatten that curve. And what that means is we're not going to get a massive spike of people having it at one time, but it'll be a progression, and that progression won't overwhelm our healthcare services, so that we can all, or at least the healthcare practitioners and physicians and nurses like myself, have the ability to care for everybody. So that's why it's so important to socially distance yourselves. Other things that we can do right now is make sure that you wash your hands, like universal precautions, like we do with any flu. Make sure you wash your hands before you touch something, after you touch something. Don't touch your face, don't shake hands. You might as well just either, use elbows or kick or whatever it is you got to do. Fist pump, bow is probably the best idea. I've been doing that for years. It's a great opportunity to take up something new like that. So just be careful. Those are really things that we can do to change the trajectory. You see, this virus doesn't think, it just acts. We're humans, we have the ability as humanity to create, to think. And we're going to beat it because we have the ability to do that. And we have the ability to act and change. It may mutate, it can do those things, but it's not thinking. We can. So let's try to use all of our brain cells and really think about ways that we can change this trajectory. Now, people might know me from the cannabis world as well. And like everybody else, we all like to sesh together. This is a time maybe that we have to isolate ourselves. No more sharing joints. Obviously, we probably shouldn't be smoking anyways. Vaporizing, I'm always a proponent of using flower. This is my 1-minute message for vaporization. But also, Same time, if you're gonna sesh, do it apart from each other. Don't be sharing joints. Don't pass things back and forth. Definitely not through the mouth. It's not the time to do that. Stay away just for a little bit. Give it 10 days, 15 days. 15 days, we're gonna know who's sick, who's not sick, because we stopped it right now. And at that time, we'll be able to move forward. But if we don't, we're all gonna get sick together. And it's best that we can avoid that. And the way to avoid it is just by being human. Create, think, do things that that virus can't do. And we're gonna get through it together. Have a great day.